Hello, and welcome to Community Advocate Network. I'm here with a couple of my friends, with a few of my friends, and we're here today to share with you about your dental health. This is also a National Child Dental Health Month for February. So we're going to give you some tips about your dental health for your children as well. Please stay tuned. We'll be back with you in about 60 seconds.
Very nice. Hey,
Thank
sister.
you. Hi.
Hello, everybody. Thank you for joining us tonight. Like she said, we are here to talk about your dental health and help you with some tips and kind of give you some insider information. All of us have either currently or have and in the past had dental careers, and so there's a lot of things that we know and understand that will help you. People don't like to go to the dentist.
I like going to my dentist because she talks to me and I can share with her, and she doesn't know any of my friends, so I don't have to be concerned about her telling anybody what's going on in my life.
So she's your therapist and your dentist, huh?
Yes, she is my therapist and my dentist, and she is very people oriented as far as, having bedside manner like a doctor would. She talks to her patients, so I enjoy going to the dentist, and I don't have to have any major things done, so that helps too.
Okay.
Yeah, Tonya is still currently. How long have you been in the dental field now, Tonya?
Girl, ever since I moved to Georgia, so it's been 10 years.
But prior to that, though, when you were here in Michigan.
Prior to that, probably 10, 15, something like that. So
yeah, you've been in the game a long time.
Yeah, I started like in whatever. That's enough. Yeah, a long time.
Come on, tell it.
That's all you need to know. It's a long time.
So where do you guys want to start? Are we starting with child dental health, or are we just going to go through a generalization of categories, or how are we going to do this?
Well, I think since it's National Child Dental Health, maybe we should start with the children and work our way up to the old folk.
Yes, that's what I was going to say.
Okay, cool.
Yeah. Oh, by the way, we're missing one of our panelists. She is traveling, trying to get home. I guess the weather's gotten bad in Michigan.
Oh,
the weather is awful in Michigan.
It is.
She's trying to get home.
Oh, that's right. She had to work today.
Yep. So she said she give her really about 30 minutes. So we'll give her some time, and then she's gonna hop in. But yeah, we'll go ahead and start with our babies. That's very important, is getting them equipped and ready to go to the dentist at a young age, so that they're not afraid and fearful. They learn and understand that brushing and taking care of their teeth is an important part of their well-being, just like washing your body and going to the doctor and all of these things. Your dental health affects a lot of things.
Yeah.
And even when we were all together working years ago, we used to see a lot of stuff with the kids, the bottle mouth syndrome, children falling asleep, drinking their bottles, and then they end up with all of their teeth decaying and needing to have a lot of dental work done. And I mean, that's still a high thing that happens, because people don't understand that you don't need to let a person go to sleep or a child go to sleep with anything that's going to have sugar and stuff in it, because it's going to decay the mouth over time. And I
Yeah.
know we want our babies to hurry up and go to sleep, and giving them a bottle and putting them to bed is one of the things that we like to do. And that's
Most
very
people
well
do
true.
that.
But you got
Most
to take,
people let their baby sleep with those bottles.
yeah, but you once they go to sleep, you got to take that bottle out, and you need to really take a washcloth or something and wipe around their mouth and get that off before they go to sleep, because over time it's going to decay them. And that's the unfortunate part, because now you're trying, you're going to probably get them, in a traumatic situation, because now they got to go and get all this dental work done.
Yeah.
So that's the first things we want to do, mommies and daddies and aunties and grandmas, is stop giving them that bottle and sleeping with it. I mean, if you give them a bottle, then you got to get rid of the bottle once they go to sleep, because you are contributing to them having a mouthful of decay by leaving that bottle with them. So
Yeah.
we want to be very mindful of that. Very mindful of that.
Let's talk about what, in terms of children, things that, if you all have like any type of recommendations for, my light just went out. Okay, there we go. For children who are afraid of the dentist, because they a lot of times they pick it up from the parents because the parents are scared.
Mm-hmm.
So, any recommendations that you guys have for, children who are scared?
I mean, it's a catch to that. And the thing is this: first of all, you have to, just like going to the regular doctor, they're afraid to go to the doctor because they don't want to get a shot. If a child is just so apprehensive to where you're taking them and you can't get them to calm down once they're there, then there are prescriptions that the doctors can provide that'll kind of give them either one, that kind of sleepy, nostalgic type way about them, so that they can just be really tired, get to the doctor, put a bite block in, do the treatment. Or they can start using nitrous. So those are the two things that usually can occur to help to calm them down enough to get the things done. But we don't want them to have to need some type of prescription or nitrous to do simple things like getting their teeth clean. They should be able to have that done without needing all of these other things to be, things to calm them to do it. If they have to have more evasive things done, then I could see that. But for something like an exam and getting teeth clean, they should not have to go through that. But again, children are scared. A lot of times it doesn't really matter. They're going to scream, holler. And you just have to have a provider that is very patient to work with children.
And one of the things that you can do before they get to that place where they are with the dentist and the staff, and they're all nervous and afraid and hard to handle. And one of the things that I did with my kids was make dental treatment or dental services just as normal as anything else you do. You've got to go get shoes. You got to go to the dentist. You got to go to the doctor. You got to go get your hair done. It's part of life. And we had a contest with my kids that the first one to get a cavity brought shame on the family. So because I was in the dental field and we didn't have cavities. And so my oldest son was the first one to get a cavity. He was 12. And when he did that, my daughters were just so ashamed. They were like, "You got a cavity? We don't get cavities in this family." So we made dental health important. And one of the
Yes.
things that I had mentioned to Deb is that let the kids play doctor, let them play dentist. One of the things that I was reading was that don't give them a lot of stuff to play dentist with, but you can get these little
The plastic thing.
mirrors from the dollar store and let them look at their teeth and explain to them, when you go to the dentist,
That's
he's going
good.
to do this. Why don't you do this for me? And then, you go through the motions of, wow, that was good. How many teeth do I have? Help them count, make it into a game. And then if you give
That's
them a
good.
toothbrush, make it a soft toothbrush. Don't put anything on it, and ask them, go ahead and brush my teeth. And then let them know that the dentist is going to do that, only they might use a different tool. And I know my dentist doesn't even put her, I forgot what you call it, the thing that you put
the rubber cup.
Yeah, the rubber cup. She doesn't even attach it to a machine anymore. So I don't know if that's standard every place, but because it's not making all that noise, then it's not scary for
Oh
kids.
yeah.
I
But
mean,
she's
that's a very good concept. I definitely think that that's a good one. But even though you
Yeah.
may get situations where a lot of providers are not doing that type of thing, nonetheless, it's just like you said, you have to incorporate that into everything else that you do, because it's
right.
just as important to have and go to the dentist just as it is when you have to go to the doctor, when you're sick from a cold, getting your regular checkup. Just like she says, going to the grocery store, buying food, going to shop for this, going, make it an event where everyone's going. And
Hmm.
Yeah.
that way it
That's really
doesn't,
good.
yeah, that way it doesn't look like you are punishing them, because they look at the dentist like
Right.
it's a punishment, and
Yes.
it's not, and you don't want to teach that to them, because then they grow up and they're fearful and, oh, I hate the dentist, I hate, want to go to the dentist, I don't want to do this, I don't want to go that. Then you wait until you start having, strong dental issues, and then that's a whole monster right there, and
Right.
you want
Yes.
to
Because
stop
then
that
they can't
before you
help but
build
to be
it.
afraid because they're getting
Exactly.
stuff that actually hurts done
Right.
to them. So, and then the parents need to not show fear or be afraid also because the kids pick it up from the parents.
Right. I mean, and
Yes.
we don't want to think the children have to go to the dentist and always need to have the gas, always need to have something to relax and put them to sleep. Let's let them understand that this is part of taking care of yourself, just like it is anything
Hmm.
else. So we want to do that.
Yeah. Now, what about thank you, Vern's Junk Closet? That's my girl. What's up,
Mhm.
girl? Thank you.
Hmm.
Yeah. Now, what about when a child has to actually have work done, fillings? Um, you know.
I mean, again, if you are taking them at a young enough age to where they understand and see about going to the dentist, they hopefully are not as apprehensive. But
Yeah.
again, when they are, there are a couple of things that you can do. Like we said, you can use, they have, I don't know if you guys, I can't remember the name of it because I haven't been in pediatric dentistry in a long time. But they used to give that, it looked like a syrup, and they remember they would take a little bit of that. They'll tell you, give this to the child an hour before their appointment. So usually by the time the child gets to the appointment, they're literally asleep because it knocks them out. And you just put a bite block in the mouth. Normally the child sleep, and then you can, put them, get their dinner work done.
So wait a
Again,
minute now. You said that they give them what now to get?
they give out a, I'm not sure if they're still using it a lot, but remember they used to prescribe this
See,
liquid.
I was never clinical.
Oh, okay. Well, they used to give out a prescription that was like NyQuil or something. It was a liquid, and they would tell you to give this to your child an hour before their visit, so it would calm them. And literally, by the time they would get to the dentist, the child is almost asleep. Because remember, I used to work for
I
Daryl
don't
Williams.
remember that.
Yeah, they would give them that. And the other thing is if they get to go to sleep, then they would usually papoose them. And that would be like, put them into the papoose where they're kind of like
Yeah.
mummified so that they don't have to move their hands and things like that. Because the thing is when they are apprehensive like that, they're not only a danger to themselves, they're a danger to the staff. Because you
Yeah.
don't want anybody to get hurt. You don't want a child fighting and bucking with you. And then you don't want to be holding a child down. So
Right.
papoosing them was one way of being able to help so that they would
Yes.
not put their hands and things and be swinging around and all of those type of things. So once you would give them that oral medication to calm them, then you could put them in the papoose. They're going to be asleep. Put a bite block in their mouth, and then now you can go ahead and get the dental work done, and that usually works. And then they would also usually give the child nitrous too to make sure that during the time of
Yeah.
doing the treatment, they're going to stay in a state of being relaxed. So those are things that are still being used today. But when there is situations where children have to have literally their whole mouth reconstructed, they usually are now taken into an outpatient center and they are being put to sleep by
Yeah, they're being totally anesthetized.
yeah,
Yeah.
and then they're doing everything in that one visit. So those are things that happen. But if you can try to prevent those type of things happening by giving good dental health habits and taking them to the dentist early, then that can help prevent those type of things. But again, A lot of it is based on diet. We're giving them high sugary things. They're not telling them to brush their teeth daily. They're just, you know, got all of this stuff in their teeth, eating potato chips and, you know, eating all of these things that cradle inside the crevices of the mouth. So that's going to create dental issues.
Yeah,
with my kids, I didn't let them eat hard candy when they were with me. I did allow them to eat chocolate, but then they knew that after they ate that candy bar, they had to drink some water. They had to rinse their mouth out, and they got in a habit of doing that. And if your kids get in a habit of their teeth feeling clean, they're not going to like it when they don't feel clean, right. Just like we don't like it when our teeth don't feel clean.
My whole thing is, it doesn't matter to me whether you rinse after you eat something. You have to brush your teeth every single day.
Well, yeah, absolutely. And my kids brush their teeth in the morning when they woke up.
If you eat the candy, rinse it out with something. You eat this, rinse it out. You need to brush your teeth every single day. That's it. Bottom line. That's the only way to introduce and have good oral hygiene is by doing that.
Absolutely. Sharon, thank you, sis. I'm gonna catch you when you go live. I saw your post. So let's talk about handicapped children. Any recommendations that you all have for children that are that have physical disabilities or even mental?
The same thing still applies. I don't know if they're still doing this, but you know, again, back in my day, I used to work for Henry Ford Hospital in the Pediatric Dentistry department. So
I never knew that.
Mm-hmm. So being a dental assistant back then, that's what we catered to for the most part was disabled children.
Okay.
Or children with mental illnesses. Yeah. So the same thing applied. You were going to give them that oral medicine that's going to help make them drowsy and sleepy. So by the time they would get to the dentist's office, we're going to control them by either papoosing them, you know, the other things we already talked about, giving them nitrous. Nothing changes, you know. And if it's a situation to where you got to do a full mouth, dental construction, you're going to do and have them put under anesthesia, general anesthesia, and do all the dental work. So, it doesn't change.
Deb, any thoughts?
I have never worked with just children with disabilities in dentistry, so I can't speak on that.
Yeah, when I worked at Henry Ford, like I said, probably 80% of the children we saw were disabled. You know, they had some sort of disability. A lot of children that could not, they had to be put to sleep and anesthetized to do their work. So that was very common.
Yeah, I was always in general dentistry. I never did any type of specialty, pediatrics, ortho, oral surgery, or none of those. Of course, you in general dentistry.
I've done every specialty out there: orthodontic assistant, oral surgery. Yes, I've done them all. I have done them all.
Okay. Did you do any specialties there?
I did periodontics.
Period was awful. I think period was the worst.
It was awful.
Period was the worst.
And I was working when you didn't put things, OSHA wasn't all in everybody's business. And so we were doing perio without gloves.
Yeah.
If you can imagine.
I remember I wasn't wearing goggles, so
back then there was no. I mean, even when they did oral surgery, you had your hand in somebody's mouth without gloves on. It was bleeding. You didn't think anything of it. You washed your hands. You cleaned your counters off afterwards with the alcohol and stuff like that, and then you went on to the next patient. Now in perio, we used to double clean the instruments. You had to clean them and then sterilize them, and then autoclave them. But we could still touch everybody with our hands.
Kim is on. You got to pull her through.
Oh, she's on the wrong link.
Yeah, I'm getting ready to send it to her.
Okay.
Yeah.
So okay, so good. So any other thoughts in terms of children who are afraid, children with disabilities? Anything else where the kids are concerned?
Well, yeah, I want to talk about things that are sometimes not really necessary that they're doing a lot of, and it's happening a lot in, especially like the DSO, the dental service organizations, like the Aspens, the Coast, and Western
Okay,
Dental.
I definitely want you to give that information.
Right. You know,
Deb,
one
you
of
have
the
any other thoughts in terms of treatment, though, as far as kids?
Well,
Because
just a few tips. And one is for parents, it's hard for adults to control their words as it is, but you definitely want to watch your words around the kids before you take them to a dental appointment, or even when you're talking about your own dental appointment. You don't want
yeah,
to talk about shots. You don't want
right.
to talk about
yeah,
pain. You don't want to talk about anything that might sound traumatizing. When they ask you about it, you just want to let them know this is someone who's going to look at your teeth to help you make them keep them healthy, because you have to have these teeth for your whole life. And so you want to have positive conversations and say the right words, just like you do in life,
And the
which,
thing is, I'm sorry to jump in, Deborah. What they will do also is they use the dentist as some sort of a threat. And you don't
yes,
want to do that. You don't want to say, yeah, they're going to go in
exactly.
and they're going to yank all your teeth out if you don't do this, or they're going to do this. No, that's
yeah.
not what we
Right.
want
That's
our
a
kids
Or
to
good
if the
one.
kid
encourage.
is not eating, child's not eating like you're
Yeah.
telling them to eat, then you threaten,
Yeah,
well, you're going to have to go
that's
to the dentist
And they're going
like
to take
it's a
all your teeth out.
punishment.
Right.
Right.
You know,
right.
a long time ago, you know, my dad used to always say this thing about, we said, oh, I don't want to brush my teeth. He says, okay, well, then I guess you don't want to keep them then, huh? Oh, goodness, yeah. You know, like you say, only brush the ones you want to keep or whatever. So you want to, so I wanted all my teeth, so I was going to brush, you know, okay, okay, okay. But we want to, you know, let them know. And again, dental health is just as important. And
It's your gym shoes, the gym shoes you got to go shopping for.
yeah. And
Right.
take and bring them in the bathroom with you. If mommy's getting ready to brush
Yes.
her teeth, okay, come on, you brush your teeth with me. Let's do it, everybody. You know, if we can bring everybody in, let's all do our brushing teeth thing, and you know, bring it
Yeah,
as a family and share it and make it an experience that shows positivity,
Right.
not
right.
something that is going to be like a punishment, because that's what we don't want to do.
And even bring your kids to your dental appointment so that they can see you being not afraid and see what procedures you're having done, so that they will see, okay, well, mom does this, so it's got to be okay.
Hmm.
Right. Yeah. These are, I mean, these are very practical things, but so
Mhm.
important to go a long way with children.
Right.
This is the thing. You know, you gotta get them mentally prepared, make it fun, you know, take away, you know, the fear of it, you know, and it's just little practical things you can do is essentially what they're saying, you
Right.
know, to get them to a place to where they have, you know, you don't want a kid dreading going to the dentist, you know.
Hmm.
Right. And you might not want
Absolutely.
to take them after some big event at school where they've been tired out, or they've overworked, or maybe some bad thing has happened to them. You might want to cancel that dental appointment, because if it's a traumatic thing, they're going to associate that dental visit with how.
Your sound. She hit her mute button by
Yeah, she hit her
mistake.
mute. Yeah. I mean, yeah, that's
Yeah,
Yeah.
you want to bring them when they have energy. You don't want them to be tired and irritated, or hungry. And then the other thing, you don't want to uh, make them feel like it, like Tonya had mentioned earlier, like it's a punishment. So you just have to think about when it is that you're going to bring them to the dentist. It needs to be at a
Mhm.
time where it's not their worst time of the day.
Exactly.
Right.
Because I mean, sometimes it's good to do them early. I mean, and I put it to
Mhm.
you this way: it's also based on your child's age too. So, you know, little children usually need to go in the morning because they're usually more energetic. They're
Mhm.
easier to adapt to things as opposed to the end of the day.
Mm-hmm.
So, and then you want to, like I said,
That's a good tip.
incorporate.
Yeah.
Yeah, you definitely don't want to do it and they're exhausted. You need to make sure and know how your child reacts at certain times of the day. If your child is the type of person, you know, oh, my children react and do things better in the morning, make morning appointments. If you need to do it after school, Make sure it's after school, but make sure it's not something that's going to be draining on them because they've been at, cheerleader practice or they've been gymnastics or whatever the case may be. But normally that's something that's typically an issue for your children. I want to say that's 8 and under. 7 is, that type of thing. 5 and 7 and under. Any children older than that, you should not have to worry about something like that at the end of the day or in the morning. At that point, you should be able to manage whatever they need to do.
Yeah. So go ahead, and Tonya, because I want you to talk about, you were going to talk about the DSOs and all of that stuff.
Yeah, one of the big things that happens a lot because I guess because they think of it as a it's not really a victory for the kids, it's doing sealants. And sealants has been out for probably 25, 30 years now.
It's probably longer than that because it was out when I first started.
Yeah, you're right. And my kid is 40 something. So yeah, it was out then. But I just don't necessarily find that to be a big benefit all the time, especially if you are a person that has commercial insurance coverage and your insurance is not going to cover it. Don't waste. I'm not going to say waste. Let me take that back. You may not want to get financially into doing sealants. Keep good dental habits, keep their mouths clean, and you won't necessarily have to worry about needing that. I find that I get a lot of situations where the dental treatment plans are including needing to do sealants for the children. And most of the time, the commercial insurance plans only cover sealants on permanent molars. They're not covering it on premolars, and they're not covering it on deciduous teeth, baby teeth.
Right.
Medicaid will, but not commercial insurance. So before you go to getting a treatment plan and they say, well, doing sealants will help prevent from having decay in cavities, find out what your insurance is going to cover. If they don't cover that for premolars, then don't worry about it. If you're not sure, tell them to pre-authorize it. And I can't say that enough. Anything that could be costing you over $300 at the dentist, you may want to pre-authorize it because the dental insurances are denying a lot of stuff, finding that it's not necessary. And then the patient is being stuck with the bill because you're signing documentation to say if your insurance does not cover this, you're going to be financially responsible.
Yes, God.
So we want to take that out of the equation by saying, hey, I'm not sure if that's something that is going to be covered. And I can't afford to not have my insurance help pay for my visit. So I need you to do a pre-authorization for that and find out what's going to be covered and what's not. So this way, once you get that back, because they're going to send a copy to you, they're going to send a copy to the dental office. You get that back, you can make the decision as to whether or not you want to proceed with doing that treatment, or if it's something where you can say, is this like really necessary? Am I going to run into a situation to having some dental problems if I don't do this treatment? And sealants is not one of those things that is going to require it to be done. If you have good dental hygiene, you don't have to necessarily worry about having to get sealants. But I cannot tell you how many times I have denied, seen claims denied for sealants, and especially on premolars. They're not covering it. Very, very, very few commercial plans will cover it. And it's interesting.
Explain what a premolar is to it, because we're still talking about children's teeth, because people don't necessarily know.
So your molar teeth are usually the teeth that are all the way to the back of your mouth. They're the bigger teeth. They're the chewing teeth. Those are your permanent, and I'm talking about after you've lost all of your baby teeth. Those are the ones that the commercial insurance is covering. The next set of teeth that they're not covering, the premolars, are usually the teeth that are like right up in here and right up in here. Not in necessarily the smile area, just before your smile area. Those 4 teeth that are up here at the top, down here on the bottom, those are your premolars, the bicuspids. They're not covering sealants on those. And I cannot tell you how many times I have seen the dental office do these sealants on premolars. It's $800 worth of treatment, and we denying it. We're not covering it. And you cannot.
In terms of the insurance company.
Yes, it's not going to be covered. And the thing is this, Understand your insurance is not a guarantee of payment, period.
No.
It's not a guarantee of payment. So you want to make sure that you know your benefits. If you are not sure, I know that they have a customer service number that you can call and talk to your insurance carrier and discuss your dental benefits so you will know what's covered, what's not. Definitely when you come into the dental office, you want to assume that they have all the expertise to understand and knowing your plan. We don't. We don't know them all. There's so many different plans and coverages out here. It's really almost impossible to know. And rather than to assume something's going to be covered, I would recommend that you know your benefits. It's your responsibility to know your plan, not the office. So know your benefits. That way you
Right,
can
but
go in there.
a lot of people don't understand their dental plans. I mean, they may look at and see, okay, I this or that is covered, this or that is covered, but they don't understand
That's why people walking
frequency.
around with no teeth.
Is that what? Yeah, it could be. Well,
Yeah.
I mean, but you're talking to, yeah, well, no,
But
not the
what
ceiling.
I'm saying to that is, surely, especially if you got an employer based plan, you can always get your information from your HR. Hey, what's my dental plan? What do they cover? They're going to just give you what the written benefit of it is, or send you to
Exactly.
the website. If you know you can't understand that, call the insurance company. They got people there all day answering phone calls and answering your questions. Understand and know what is covered. So if you go to the dentist, you go get your teeth cleaned. So now they're saying,
No,
okay,
hold on. Wait.
what's that?
You can't say know what's covered because it's just like what we used to do at MITA, a DHMO. Oh, we cover everything.
No. I'm not
Wait it.
saying that in the dentist's office. I say call
No,
your insurance company.
that's what I'm saying. When we were at MITA, that, oh yes, that is fully covered. That is fully covered. They don't know that they're the type of policy that employer has purchased. We're not talking about
Not
Medicaid.
now. That maybe you talking a long time ago. We
Okay,
know.
but wait
We
a minute.
know.
Let
We
me
know what
finish.
plan. We know what
You
plan you
gotta let
got.
me finish the statement so you know what I'm asking.
Okay, go ahead.
So okay, so it may have changed now. So I'm saying they would say everything, if they call their insurance company and it's a DHMO, they say everything is covered. They don't know that they have to go to specific providers in their network. That's number one. They don't know the time limitations and the frequency limitations on certain things. Maybe it's a prosthetic, maybe it's a any type of major restorative procedure, like a crown or a root canal or something like that, where you're only eligible every 5 years or whatever the case may be. So I'm saying you got to be specific, when you explain and what they need to, specific things that they need to ask their insurance company when they call, because just to say you have Blue Cross is not enough, because Blue Cross has a million different policies that they sell to various employers. So you may be covered by Blue Cross and they may be the best insurance, but the policy that your employer bought may have been the cheapest one
Okay, but
with
when you're
the
calling,
fewer benefits.
they're getting your information. What's your name? What's your member ID? What's your date of birth or whatever? They're going to ask you. They're going to pull up and see what you are enrolled in. Then they're going to look at that and say, okay, so what are you having done? They said they want to do x-rays again. Okay, looking at your policy, x-ray bite wings are only allowed once a year. So if they did, you had these bite wings done 6 months ago. So if you're going to get your teeth cleaned right now and you get bite wings done today, your insurance is not going to cover it. Okay, whether it's PPO,
Will they say that though when they call the insurance
they're
company? 'Cause
supposed
I
to.
know,
They're
yeah.
supposed to. That's why you're calling. Okay, even if you're going to get a crown, maybe you're not sure. Well, what kind of crowns do they cover? Did they give you a code? Yes, they said it's going to be D2740, which is a ceramic crown. Does my plan cover that? Yes, your plan does cover that. So how much would I
But
have to
for
pay?
what tooth numbers?
It doesn't matter.
Yeah,
No,
it doesn't.
no. Mm-mm. It doesn't matter.
Okay.
Now, if they say okay, now let me back it up. So say they're going to do a ceramic crown and it could be on a molar tooth, and maybe your plan only covers cast metal. That representative should be telling you that. They should be saying, based on what I see in your policy, your plan covers this for these type of teeth. Did they tell you what tooth number is on? Did they tell you what code it's going to be? Ask the doctor. If they're giving you a treatment plan, the codes are supposed to be on the treatment plan, the tooth number is supposed to be on the treatment plan. So if they don't want to necessarily pre-authorize it for you, you can call your insurance and say, well, they gave me this list. This is
Right.
what they said. And
There
then
you go.
they're
Yeah.
able to look on that and say, that's not covered. This is covered. They'll give you an alternate benefit. Because this is the thing, and let me say this, and this is so weird. Medicaid will cover composite resins on all of your teeth for the most part.
Really?
They will do composite resin on molars where a commercial insurance will not. They're going
Right.
to downgrade it and bill
To
it
an
and pay it.
amount.
Yes. And then you're going to pay the additional cost yourself. Tell me, why are they still doing this when they know 80% of dental offices don't even carry amalgam anymore? And they're still not making it a benefit. They're not making, I mean, they don't even, dental offices don't even carry
Okay,
amalgam.
Deb, you got to chime in here. What's your thoughts? What's your thought? Because I see you thinking.
Well,
Go
I
ahead.
agree
I
with
have to
Tonya.
go back in my mind.
I think I'm thinking of it like when you go to your physician, you have to ask questions and don't assume that they're only going to do the best for you. You have to also protect yourself. You have to find out what you can afford, and if I can't do that, what's the alternative to that? It's I believe it's up to the dental office and your dental insurance to help educate you, because you just don't know. And I know if anything where I don't know and I'm calling somebody who's supposed to know, I ask them, what questions would you ask if you were in my situation?
Mm-hmm.
And that's what you
Exactly.
need to be doing when
That's
you call
good.
your insurance
Exactly.
company.
I mean, even with my health care, I
Good.
had to, they wanted to do some type of test or whatever. And I said, let me make sure it's going to be covered. And I called them and they said, no, it's only covered if it's in connection to this and this. And did
See,
they say that that was part of it? I'm like, nah. She said, did they
that's
give you the
what I
code?
wanted to. Yes.
Yes. So I gave her the code and she says, no, you won't be able to get that done. It's going to be this, and this. Or if it's going to be part of your deductible, how your deductible is going to apply
That's
to
another
that.
big
So
one.
those are the type of things that you need to ask. So when you're going in there, I mean, because we've been in this business for so long, it's not only important to me for my dental, but for my medical. So I'm always making sure when I'm getting ready to get something done, I'm asking those questions. As Dave said, okay, so what did you want to do, and how, are you showing that it's covered on my plan? I'm not sure. And now we got cell phones all over the place. I will sit down and call before I go back there to get it done to see if it's going to be
Absolutely.
covered.
Yep.
So
And
you're
even
not.
find out, like I said, what questions do I need to ask? Because when you're talking
Yep.
to your doctor, they want to get paid too. And
Yep.
so you want to ask them, what things does my insurance cover? If they don't know, okay, well, what do you think I should ask them? And then when you're talking to your insurance company, what should I be asking my doctor? So you're involving everybody, and then you're the one that's supposed to be making the ultimate decision, because they want you to be able to pay them.
Yes. And they're
Right.
going to not write it off because your insurance is not covering it. The only time that can necessarily happen is if the explanation of benefits says that the patient is not supposed to be charged and they are a in-network
Right.
provider, they can't charge the patient.
That's very important.
They
Say that.
cannot charge
Yeah.
you. If they are an in-network provider, they cannot charge you. That's dental or medical. If
Yes.
it's not saying that you are responsible and they are an in-network provider, and it gets denied, you're not responsible for paying it. That doctor is going to have to write that off.
And so,
Yes.
just like with everything else in life, if you're spending your money, you need to ask questions of the people who are charging you before they actually do the service. It's like if
Yeah.
you're getting new carpet laid, or you're getting drapes, or you're buying a dress, you need to find out, well, what's the return policy, or how can I handle this? So since you aren't returning your medical service, you need to find out what's going to be covered before they do it. And even with your tooth, if they say that you have a couple of options, you can get a root canal and a crown, or we can do an extraction. You need to find out. So what's the consequences if I get an extraction? How's it going to affect the rest of my teeth?
Right.
Because people don't think about the fact that, okay, so you got this tooth removed, now your teeth's going to start
space in your
opening
mouth.
up, right?
They're going to shift, and then you're going to have other issues. So that's why I said, typically, if you're going to the dentist and they're sitting down and they're getting ready to give you some options and they're going to exceed $300, tell them to do a pre-authorization to your insurance.
That's good, Tonya.
I don't care what it is.
That's an excellent tip.
If it's over $300, get a pre-authorization. And the pre-authorization is going to do a couple things. Not only is it going to tell you what your out-of-pocket responsibility is going to be, it's going to tell you if that doctor is credentialed with that plan. Because this is the top ticket.
Good.
Places that are DSOs, especially, they have a lot of doctors. They don't credential every doctor. They credential the facility, but not the doctor.
Right.
So you go and you're at XYZ Dental, and only the doctor that owns the facility is credentialed. But they got Dr. Booth, Dr. Smith, and Dr. Jones,
interns, and
they are not credentialed. But that is who treats you. That's whose name is going to be on that claim form. And they're going to deny it and say that doctor is not credentialed, patient's responsibility. Yeah. So you want to make sure whoever's getting ready to touch you is a provider in your network if you don't have out-of-network benefits. Now, some insurance plans will have in-network benefits and a lower percentage. But very, very, very few do. Yeah. Very few. They're not, because that's a more
that goes plan. Back to what plan your employer purchased.
Exactly. It's exactly. Because they don't understand the insurance company has nothing to do with what turns up on your plan. Yes, we are the administrator of it, but when it is sold to that employer, whatever they sat down and decided and agreed on what they wanted, that is what's going to be covered. So if you get a plan where, say, for example, you need a crown lengthening, okay? And crown lengthening may not be covered on your plan, but your dentist says, well, in order for this crown to fit better on your tooth, we need to do a crown lengthening, which means they need to take gum tissue off from around that area to open up more tooth, so that crown's going to fit. But if your plan does not cover that, then they're going to charge you for it. Yeah. And that's an expensive procedure. So you can't call your insurance and say, oh, well, my doctor says if I don't get the crown lengthening, I can't get the crown. Perhaps. However, your plan does not allow that. And regrettably, you'll be responsible for it.
Right.
So you have to look into these things and understand that your plan may not cover everything. It's not a guarantee of everything that you need to have done. And when you and now, because of us having the marketplace plans, there's a lot of policies out here that people are buying for dirt cheap. These plans have a lot of waiting periods.
You're talking about the plans that they're selling in the dental that they have you sign up for inside the dental offices?
No. I'm saying the plans that you buy when you get the dental.
Oh, the marketplace, the insurance marketplace.
Yes, and you know, or either for the seniors when they're buying and they're taking and getting Humana. Humana is a real big dental. Real big plan for seniors to get, and they'll say, well, we'll give you a dental plan with your Humana healthcare, and you can go and get your teeth clean. Oh, really? I haven't been to the dentist. Hold on, let me tell you something about that, baby. There's a trick to it. Yes, ma'am, there's a trick to it. Because the insurance companies are now making you have to sign up your doctor, not only as the PPO provider or the in-network provider. For the commercial, you got to have a certain doctor that signed up with these Medicare plans. The PPO plans and the regular ones, they're not, those doctors are not credentialed to do the Medicare plan. So now you go and here you are, 75 years old, haven't been to the dentist. You like, Lord, I need me a new partial. You thinking you getting ready to go in here and get a new partial, get your teeth clean, get all of this stuff done because they said my Humana gave me dental. These doctors are not credentialed. And they're not telling them that they need to credential as a Medicare provider, and they're denying it all, and the patient's getting stuck with it, and they're on fixed incomes, and it's driving them nuts. So stuff
Wow.
has changed so much. It's incredible. So that's why I
Yeah.
said get it pre-authorized. I mean, even with the Humana plans that are putting this dental rider onto the healthcare plan for seniors, it's not even covering things as simple as a cleaning. If that doctor is not credentialed, they're not going to cover that cleaning. So now you've gone in there and got a cleaning, some X-rays, and an exam. Now you got a $300-400 bill because it's denied because that provider is not credentialed.
Okay, so let's take a step back. Let's take a step back because I want to get through some of the other dental stuff because that insurance stuff is like we need to really get that information because that's the money part. So we need to
Mm-hmm.
really make sure that they understand completely exactly how these plans work and how they're designed and crafted and stuff like that, so that they know certain things, what questions they should be asking, what treatment, see if we can come up with a couple of scenarios in terms of what may or may not be necessary in a treatment situation or something like that. So, what other categories of information do we have to share?
Well, one of the things that is becoming very, 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 very common is the scaling and root planning, the cleanings, the deep cleanings that what
Right.
most people know them as. So if you have not been to the dentist in a couple years, they're most likely going to say you need to have a deep cleaning. And they're going to tell you you can't get anything done until you get this deep cleaning because we need to get all this debris and everything out of your mouth before we can start restoring it. And that's a good point. However, the insurance companies, again, have gotten very, very familiar with not covering them because it's not enough pocket depth, negating that you need to get it done. And, that is a very expensive procedure. It's usually, so if you take your mouth and put it into 4 parts, upper right, lower right, upper
Or
right, upper
quadrants.
right, upper left, lower left. Those 4 parts are what normally needs to be done if you have to do a whole mouth. And that can be anywhere from $300 per quadrant all the way up to sometimes I've seen $500, depending on where you are.
Yeah.
And then it turns out that once we get the claim, we get all the information in there, we don't see enough millimeter pockets to say, yeah, that's needed to be done. They could have still set you down and did a couple of the teeth that may need to have the scaling and root planning, which, is just needed. And then everything else, it may require you to have the hygienist dig a little deeper and, get a little bit more of the plaque and tartar off. Does not mean it's a full scaling and root planning. And I'm seeing a lot of that. So when they tell you that you need this deep cleaning and the deep cleaning is going to cost a total of $600, get it pre-authorized before you get it done. Because if they're saying from the insurance company it does not meet the criteria, then you probably don't need it. It's just that the dental office is not wanting to do a regular cleaning because they're trying to make money. That's what they do off of us as the consumer. They're looking to make money from us. Dental is nothing like it was when we first got into the game, y'all. Nothing. When I got back into it 10 years ago, I was blown away. I had people that were, I first started off working in customer service, taking calls. People were getting $15,000, $20,000 dental plans. I'm like, what the world? What? Remember, we would sit down and do a dental plan. Your dentist dental insurance only had what, $1,000 to $1,500 maximum per
Annual
year.
max.
And
Right.
who was our top
And
payer?
the $1,500 was the good insurance plan.
That means you was working for the UAW, Chrysler, General Motors, and Ford.
Yeah.
Okay, that was your 3 tops, and they had $1,500 maximum. Well, first it was 1,000, then it went up to 1,500. Then who was next? The Board of Education.
Board of
Board of
Education.
Education was the
Yes.
next big plans that we dealt with. So after the auto industry, next came the Board of Education. So those were the plans that had the highest coverage, because remember, crowns and stuff like that and root canals was covered at 90%. All
Yes.
those things, a lot of those have transitioned to class 3, and they're only covering at 50%.
I was just getting ready to say, Debra, explain. And there's a couple things I want to bag up because you gave us a lot, Tonya. Explain the difference between the classes of treatment class 1 procedures, class 2 procedures, class 3 procedures,
Well,
and how some things. I want to give Deb a chance to.
hold on,
Well,
but
I'm gonna
Debra
have to
ain't
let
given it.
Tonya do that
Yes, because
because
it's not
dentistry
considered that.
has
That's just
changed.
how we know it.
Mm-hmm.
Okay, first of all, a class 1 is now considered just preventative. They don't call it like that anymore. It's just that we old school, we know it. So
What
class
did they
1,
change it to?
preventative. So class
Okay.
1 is called preventative. Preventative is your exams, your x-rays, your cleaning. Okay. Class
Right.
2 is now called restorative. That would
Okay.
normally,
This is the same.
yeah. So that would be your fillings, root canals, extraction. No, because sometimes the extractions they're going to class 3 or surgery.
Well,
It's
extractions,
usually
general
right.
extractions, simple
So usually your
extractions.
class, usually your class 2 is your restorative. So those going to be your fillings, root canals, and crowns. They could possibly root canals be far as major in class 3, but it all depends on your plan. Then
Okay, stop right there. This is one point I want to make sure that I point out to the audience, and then we got a couple people making comments that I want us to address. So there are times when certain procedures when we look at dental procedures, everything is set up by codes. So each procedure has a procedure code. Certain codes go into certain classes. So when you hear Tonya say class 1 procedures are anything that is considered a preventative procedure, a cleaning, general cleaning, and things like that. Certain other exams, x-rays, and all of that kind of stuff can be considered preventative. When you start getting into your fillings and your extractions and some other procedures, then those are considered restorative treatment procedures.
so
And
let
then
me say
you
this.
have, let me finish my thoughts, and then you can come behind me, because I want to make sure that the audience, because we're talking, we know what we're saying to each other. They may not know.
Right.
So
That's
I
why I was
want
going
to
to break
make
it down, but go
sure.
ahead.
Yeah, I want to make sure that they understand. So then you get into your class 3 procedures, which is generally your prosthetics and things like that. But it was something that you said, and I lost my train of thought. But it was something that you said. I know you were talking about crowns and root canals and things like that. Depending on the type of insurance that you have or what particular policy you have, they may classify those procedures as restorative, which would be a class 2 procedure, or they may consider it under a class 3 procedure. And the difference is the money. Because if they cover it as a class 2 procedure, that means they're going to pay a higher percentage of the bill. 90%, 80%. Our your general, anywhere between 70 to 100% could be covered if it's restorative.
Right.
You get down to a class 3, they're usually only going to pay about half the bill, about 50%. Has that changed, Tonya?
No.
Yeah,
And that's going to be
I
like
wanted
you
to
say.
make sure they knew that.
Right. And that's going to be like your dentures, your partials,
Yeah, all your prosthetics,
bridges, that type of stuff. Those
yeah.
are the things that they usually cover at 50%. But they're also taking it, like, say, for example, when you're getting these marketplace plans, they are breaking it into just 2 areas: basic, major.
Oh,
So your
wow.
basic is just the exams, cleanings, x-rays. Then it'll take your major and move it into a waiting period status. So you will have to wait 6 months to get things like fillings.
What?
Yes. Then they'll take another portion of the major and you have to wait an entire year.
Okay, who makes you wait for this?
A lot of the individual policies, the marketplace policies, or you go online.
People are purchasing on their own.
Yes. And you're going online and purchasing a dental plan. Yes. So that's why I said it has changed so much, so much. And
Wow.
the reason why they're doing that is because of this. They're not going to allow you to go and purchase a plan and you keep it for 3, 4 months and then you get all this expensive dental work done. The insurance company is help paying for it and then you cancel the policy.
Mm-hmm.
Okay.
Okay.
Yeah.
So they are figuring, okay, surely we're going to help you get coverage. However, it's going to be broken down like this. Your first immediately, it's going to cover basic, which is exam, cleaning, and x-rays. And I'm talking simple adult cleaning, simple child cleaning, nothing that is going to be something. She said she had to wait 6 months for
6 months.
the crown. Yeah, nothing that's going to be high cost is going to be introduced in that first period. So that first 6 months is just like, and then you only getting one exam, maybe two. They're not just letting you go to the dentist and get a number of exams. No, you're not doing that. And they're including an emergency exam with a initial and a follow-up exam. All of that now is part of the same thing. Where remember before there was no limit.
You can have an emergency exam. You can have
Yes,
a regular exam.
yes,
And they were
that's
two
it.
separate things.
That's it.
Oh,
Then
yeah.
Exam
it'll be
is an
over.
exam. Oh my
Yes, it's
goodness.
over.
Yeah.
That means you
That's
get no more exams
major.
that year. They're
Oh,
they're
that's
putting that
awful.
right. Remember, we used to do it. You could come in and get an
Oh,
Yes.
emergency.
yeah.
Not now. That is considered part of the preventive, and they're only going to pay for 1 or 2 a year. It's done. And hold on now. Let me tell you something else. Also, like say for example, your initial exam, which we used to then call it the initial oral exam, IOE. Well, now it's
Yeah.
called a COE, a comprehensive oral exam. Some
So they can lump them
insurances,
all together.
yes, hold on now. Some insurance companies will only allow
Wow.
that to happen once in a 3-year period, even if you're going to a new dentist. Because you'll say, well, I'm going to a new dentist. They can bill for that. Nope. They can bill for it, but the insurance may not cover it. They may say, oh, you had one of these within the last 3 years. It's not covered.
Right?
They may do that.
Yeah.
I'm telling you, it's a game, honey. It is so
Oh, yeah.
serious. I'm telling you,
They're
I
making
think
the
the
money
dentist
now.
See,
got
that's
mad.
why I'm so glad I told my kids they have to take care of their teeth
Yes.
because
I'm
Right?
telling
it's
y'all,
going to be
I
very
could
We
not
didn't know
expensive.
believe.
2020 was coming.
No, I didn't know it was coming, but you know what? They don't have cavities.
Yeah.
And they don't have, well, they
Yeah.
still do have, you still do have to be concerned about your gum situation.
Yeah, because
Yeah.
you could be the type of person where you never get decay, but you have bad period stuff. Because
Right,
that was how it was. It
exactly.
was like some people I know, they're like, I never get cavity. Well, I'm a cavity queen, but I have excellent gums. I
Yes.
don't have no problem. I can go to, and I played with a dentist not too long ago. I hadn't been in like 2 years. I just hadn't had time. I didn't go. So I sat there. So I said, let me see what this chick says about my mouth. I ain't gonna say nothing. When the last time I had my teeth cleaned? So she says, when's the last time you've been to the dentist? I said, it's been a minute. Why? What's going on? Oh, nothing. You look pretty good. I don't think. I said, so what type of cleaning you think I need today? Oh, we're just gonna do a regular adult cleaning. Boom. You better have said that because if you'd said anything else, oh, we was about to be having some words because I know my oral health and I know my situation in terms.
Right.
I mean, I don't pick up tartar, plaque. I've none of that. I'm never on that. But I am a cavity chick. Every once a year, I got to get a filling.
And see, so I'm the opposite. I have only
Yeah,
had
I have
3
more
fillings
problems
in
with
my
my gum.
entire life, and they're all occlusal fillings on 3 teeth. But I still need a 4341.
Yeah,
Mm-hmm.
see, I've never had one. Never had a 4341 ever.
But see, I think I see a lot of that could be. I know my issues with my gums started when I started taking more and more medication.
Yeah, medication
Well,
will
I was
change
told
that.
mine was hereditary.
And that's part of
Okay.
it too. It can be
Okay.
hereditary, and also medication will definitely change that.
Medication will do a job on
And
you too.
it'll become an issue if you're pregnant. A lot of women have
Yep.
problems when they're
The
pregnant,
baby.
where their
Yes.
gums are going to be
I've
inflamed
seen women's
more.
teeth go pure D rotten
Yeah,
having a
their
baby.
gums will be a lot more inflamed, and
Yeah.
a lot of policies will allow additional cleanings because of that pregnancy. It
Okay.
will say in the guidelines, additional
40.
trophy or cleaning is allowed if the mom is pregnant. It'll say that too, and it'll cover it.
The
So Sharon is
4341
asking, yes,
is
I was going to
a
say.
scaling where they have to scale your teeth. It's not, some people call it a deep cleaning, but it's not, they don't have to cut your gums or anything like that. They just have to scale.
Right. But remember
around
I
your teeth.
said what I said about that deep cleaning, couple things. Get a pre-authorization for it first.
Well, see,
because a
with
lot
my
of
insurance,
people,
you don't have to do that. They just, you can
I mean,
do it,
but
and
that's
they
right, but
pay
that's with
100%. I think I have like a $9 copay, and
right.
that's it.
That's with some plans don't. And you know
Right.
dental, so you can work with that.
Mm.
Others that don't know that, I'm telling you, you have no idea how many of these are denied in my company. And I get
Yeah.
appeals for them, and I have to explain to them once we send them to the consultant and they look at it and they still deny it. No, there's not enough pocket depth. There's not enough for us to warrant a full mouth scaling and root
Well,
planning.
let me say this. Here's the thing, and I want to address a couple of these. She
Yes,
said
Sharon,
that's a
she said it is.
$600
That's
meal more.
exactly.
Exactly.
And they get
And
denied
I want to
often.
address her situation, and there's another situation in the chat, because that goes back to what I was trying to say earlier. The doctors should know. Now, there are cases where it's borderline, and they may err to the side of caution and recommend the deep scaling, the deep cleaning. But for the most part, a doctor should know where those levels are in terms of where an insurance will cover it and when they won't.
They
When
should, but they're not doing that.
I know it. That's my point.
Mm-hmm.
When they recommend those services to a patient, they should know, okay, she doesn't have enough pocket depth to even go that route. Her insurance is not going to pay for it. I'm gonna go ahead on. I'm gonna send her to put her in the hygienist chair, let her do,
A traditional regular adult cleaning.
A regular prophy and center. Well, they may do some, plaque, cleaning up plaque. But I'm just saying, and just charge them accordingly. But a lot of the doctors will not do it. They will go for that high price tag
instead of saying
item and leave the patient stuck with those
right,
bills.
or just realize that they just need it in a couple areas. Maybe you just see a few teeth in that area that need to have the deep scaling, and it's called a limited. And it's that one is the D42, 42. So maybe it's just a couple teeth. And normally that just is like way in the back because people can always get back there and brush well. So you'll have the pocket issues more so back there. So build based off of that, not just off of we're going to do a whole full mouth scaling and root planning.
This is what I'm saying, Tonya.
It's the ethics and it has changed. The game has changed.
That's why I said I love my dentist. Mm-hmm. She looks out for me. She knows what my insurance is going to cover. She's honest. We have good conversations, and I'm
Kim, come on. Well, I'm gonna drop the link, Kim.
I dropped it to her. I don't know why she's not on.
She just got home.
Oh, she must have been listening from her car or something because she was on earlier. But I did text it to her.
Yeah.
Right, but
this is what I'm saying. This is what I'm saying, T. Explain it to the audience, so that they know if they are recommended that type of treatment. Ask the doctor this: is it the full mouth? Is it a particular quadrant? Because you explained to them about breaking the mouth into the 4 sections. Is it a particular quadrant? Is it a couple of teeth? Give them that information so they know what questions to ask.
I gave that answer by saying if it's over $300, get it pre-authorized.
Well, yeah.
Because most of the time, a scaling and root planning is over $300, one quadrant. If it's one quadrant, I mean, very few doctors are doing it for under $300. Sometimes I see some come through and it's like $280 or something like that. But for the most part, it is over $300 for one quadrant. So I say have them do a pre-authorization So you know what you're going to be covered. Not only is it going to give you the pre-authorization telling you how much your out-of-pocket cost is going to be, if who that doctor that they pre-authorized under that name, that's who you need to make sure is going to be doing that treatment. I mean, the hygienist may be doing the scaling and root planning. Don't get me wrong. But the doctor has to come behind the hygienist to do that exam, and they're going to build that. You want to make sure whoever they use is in that network, because this is what they do. And I'm going to tell you who's very popular for this. Aspen Dental, Coast Dental. They don't credential all their doctors. You go there because they're convenient. They're open every day. They got long hours, so it's easy. But when you go to get stuff done, they're having you see doctors that are not credentialed, and then you end up getting your claims denied.
And see, we
insurance
never had
companies,
that issue back in the day.
I'm telling you, it's totally different. Because even when that changed, I'll give you an example. Blue Cross Blue Shield, Delta Dental, Cigna. They used to go back and credential the doctor based on what you submitted. If you say, oh, well, we need to go back 6 months, they would do it then. They're not doing that anymore. They're only making it effective the date they approve that doctor. So if you have claims or something from 3 months ago, whatever, they're not covering it. They are telling you, hey, we're not covering it. You're going to have to bill your patient, or depending on your plan or your insurance carrier, they may go ahead and just, say, we're not going to do this or do that. So it's the dynamics is so different now. That's what I'm saying. And then you get in there and you think, oh, I want my mouth pretty. I want to smile. I want it to be this. And you are well within your rights to want that. You really are. But I can't stress enough. Learn and get your plan. Read and find out about it. If you're not sure, call your insurance plan and ask them. Find out from the doctor, okay, you guys need to do what again? Okay, can you tell me what those codes are or what this is? Go ahead and let me find out if my insurance is going to cover it, because I can't afford to pay you if they don't.
Yeah.
And like I said, they're out here doing these big plans. Then they're just taking it and they're telling you, oh, sign up for Care Credit. Care Credit is a credit card that covers medical things, not just dental, but they do a lot of medical stuff, because people are doing it with getting cosmetic work and all of these different things. I mean, and then the Care Credit is good if you need to have something done and maybe you run out of benefits. But keep in mind, first of all, Care Credit is high interest. Okay. So you only end up being interest free, usually either for the first 3 months of it or up to 6 months, sometimes a year. It also depends on how the doctor sets it up. But once that interest period is up, baby, they got some of the highest interest you turn around and seen it before. They will turn around and next thing you know, your bill has increased by 30% because their interest is so high. So I don't like seeing consumers being taken advantage of when they can be told how to make this work for them. And that's why it is such a passion for me to make sure that people learn and know how to use your benefits. If you're finding out I only get $1,500 a year, then how much and what can we do until my benefits, renew for that next year? And then we'll come back and do the rest of it then. So somebody was saying my insurance covers a deep cleaning. It can, but a scaling and root planning, for one thing, usually is only covered once in the 24-month period. It does not it's not something they're going to allow to be done over and over and over. And once you get it done, then you move into just getting a regular perio cleaning from that point on. You usually don't even qualify for a regular cleaning once you've had the scaling and root planning. Now you're doing the perio cleaning. So all of these things change and make your dental maintenance more expensive. So you have to think about that and keep all that together. So somebody says, I got a cat.
She loves to travel with the wave. Thank you for tuning in. Sis, she's saying she has to do a crown, a cap, $725 out of pocket. Why?
Because it's only covering 50%. The crown probably
Hold
costs
on. Are they charging
$1,550.
$1,500 for a
Child,
crown?
please, they charging $2,000 for a crown. What are you talking about? Yes, yes.
So,
And
Dad,
an
we can see how
implant,
long you and I have been out of
yes,
the business.
and an implant is starting at 3,000 and up. So yes, a crown is every
I'm
bit.
thinking the procedure just got totally
Mm,
denied.
mm, mm, mm. And wait, y'all remember this? You have to do the impression, send it off to the lab. Girl, they making crowns in the dental offices same day.
They're making them in the dental office the
Yes,
same day.
same day
What?
crowns. Yes, they have a machine and they're
Wow.
making them same day. So they'll prep you, do whatever, and tell you to go have lunch, go do this, do that, and come back this afternoon. We'll put your crown on. Now that type of experiential express dentistry is
That
going to
can't be.
cost
They
you.
don't. That has to be the practices that have the technology and all.
Yeah, everybody doesn't do that, but yeah,
Yeah,
there are
yeah, yeah.
practices out there that do that. But yes, they are doing same day crowns. And I couldn't believe that. Like I said, it's been 10 years since I've been in here. So we have this thing that's called the Hampton here in Atlanta. And that's a dental what's the word? It's a dental fair that we go to. And you get and see all the new equipment, you see everything that's going on, all the new technology and all of these different things. So she said, Home Depot, my plan's $2,000 max. Yeah, so I, hadn't been in the game in so long. I go in there, I'm about to follow it. I'm like, y'all doing one day crowns, same day? It's like, yes, ma'am.
I almost wouldn't even trust that. I
Yes,
guess
amen.
because
But they have a machine, baby, that they take that impression. They get
wow.
that's not all care credit, Kim. All of them don't do it, but most of them
Kim, come
do.
on, come
Yeah,
on.
but yes, so they're making some of these crowns same day. I mean, it's very few, and the thing is you see more European
Yes,
offices
the
doing
game
it.
has changed, Kim.
Yeah,
We see that.
and the thing is you see more high tech dentists and doctors that do that, and it's usually
It's
more
called
European providers. They can make the ceramic
serious
machine,
machine.
yes, in one day, and you're gonna pay for that crown. That crown gonna cost you $2,000 or more.
Oh, her office does same day crowns.
Yeah, so that's what I'm saying. It's done. It is done. Things are different, baby. Dentistry is like I said, it's like nip and tuck. Remember that show when people used to do all of that surgery and do that? You can get things, a lot of them done the same day. Now, you can't get a denture and stuff like that. I haven't seen those done same day because you have to do so many try-ins and all of that stuff to make sure that works. But let me share this with you. Now, there's one particular DSO, dental service organization, is what that means. And those are places that have a lot, they're dental chains, your Coast Dental, your Aspen Dental, your Western Dental, Sage Dental, those are DSOs. They are doing things that are not illegal, but they know the insurance is not covering it, but it puts the patient on the hook for it. And what they're doing is they're saying, oh, we can give you these teeth that just look like they were actually your teeth. They're ceramic porcelain-based teeth, but your insurance doesn't cover that. But we'll do it here, and they're charging the patient an additional $500 to $600 to do that.
So they're billing the insurance company for the lower cost product?
No. They'll just bill for the denture, which is including the teeth. But now they're saying to the patient, we can give you this enhanced benefit of these ceramic porcelain teeth to go on your denture to be so pretty, just look just like it's yours. But your insurance is not going to cover that. However, you sign a financial treatment responsibility for this enhanced benefit. So technically, the insurance companies, they're going to deny it because, again, it's supposed to be part of the treatment. So you're now paying for something that's really not that much different than what you're going to get included in the denture anyway. And if they're adding and putting something funky to it, that's because they want to pay less to the lab. So they're going to give you something that's going to look very generic. So it's all a spin on everything to make you come out of your pocket more.
And see, I wouldn't want to go to a dental chain. I never have liked dental chains. That's why I go to an independent dentist.
I mean, that's your best bet, but some of them are greedy like that too. They're very what do you want to call it, focus driven on high dollar, because like the DSOs, this is what they do. They have meetings and they say, this is the production we want done every day. It needs to be $20,000 a day. And they're doing things like you go to the DSOs, you go and they're charging. Remember how we used to put Dical and Copolite with your filling?
Uh-huh.
Okay, well, They charging for that. And what they do is they use a different type of material now. And they're saying, oh, well, we need to desensitize your tooth once we put this filling in here so that you won't feel hot or cold. And they're charging you for that. And it's not, and it's considered a miscellaneous charge. So usually it's like the D2999. It's not really a code for it. Some codes they do have for it. I think it's 4383. I can't remember how it's titled, but they have that. But they're charging for that. And technically it should be included with it. And in dental school, the dentists are taught that can be done per quadrant, not per tooth. The DSOs are doing it per tooth.
Oh,
$30 to $60 per tooth to make you spend more money.
I guess I would ask myself, since I don't want to go to a chain dental company, I would wonder, why would people go to a chain dental company?
Because it's easier to get in. Some dental offices can't get you in for 4 or 5 months. A traditional regular, you can't get your cleaning for 5 to 6 months. They have a much bigger facility. They have more dentists. They have more hygienists. They have later hours. So they're more accommodating to you. So that's why you end up going there. And because it's for those very reasons. It's because of accommodations. It's because it's convenient. So it's not based off of that. I mean, I
agree. Those chain dental offices is like the convenience store.
Yeah, they're not good. They're not good for you.
Yeah, I wouldn't want to go to a chain dental office.
Yeah, Kelly said the same thing. Convenient.
Right. I mean, I would never recommend it. I mean, the only time I would do something like that is if I'm in extreme pain and I cannot get to a private practice.
I never even wanted to work in one because I wanted individual stuff. I wanted to be able to be individual. I wanted to be able to treat my customers or patients individual. Just never. I don't even hardly like chain anything.
Right. Well, let's move on to a couple other things I want to make sure that I touch. Is that we've talked about sealants, pre-authorizations, perio treatment, which is high. We talked about the credentialing, about the providers not being enrolled. Make sure you check to see that is certainly your doctor's credential. Let's talk about coordination of benefits. When you have 2 commercial plans, that's even changed now. Remember how you used to have coordination of benefits and what your primary plan didn't pay, the secondary would pick up? Not anymore.
Well, wait, let me go a little farther because now this is my area of expertise.
Okay, let me see what you know.
I was up there handling the money.
Let me see what you know, because I bet you don't have it now.
What the difference is. I know it's probably changed now. But now, with the COBs, with coordination of benefits, they used to, yes, your primary insurance would pick up, and we need to explain how primary and secondary insurance works, period, in terms of what becomes primary and what becomes secondary.
But has that changed, Tonya?
No matter what the circumstances are, if you have insurance through your employer, you're always going to be primary. And then your husband, let's say your spouses, is going to be secondary, period.
Okay.
And for the children, it still applies with the birthday rule. Whatever parent is first in the year, then that's who's primary. So that's
the birth month, isn't it?
The birth month. That's what I said.
Month, not the birth year.
Yeah, I said whoever birthday is first in the year. So the month. Yes. Right. So yes, it's the month. Now, go ahead.
But now, what used to happen is when there is a coordination of benefits, which simply means you are covered by 2 different insurance policies, like she said, whether it's your individual policy and your spouse or whatever. They used to have to write off anything left over because whatever the primary didn't pick up, the secondary would automatically pick up the difference. And if there was anything less left over, the dental office would have to write off that balance.
As long as the provider
charge. And as a matter of fact, I think it was illegal to charge a patient after the 2 insurance companies paid.
That's only if that provider is in the network.
Okay.
Now, if
here's the other thing I want to say, and then you can tell us what is going on now. as far as COB. She said, but the payout has changed. You now have out-of-pocket expenses.
Yes, that's what I was
Okay.
getting ready to tell you. Because
And she said, not if it's a PPO.
right. But this is the thing. Yeah, if it's PPO, usually you don't. But you can still have to pay your co-insurance costs, whatever your out-of-pocket co-insurance. You still would be responsible for that. But before, remember, you used to didn't have to pay that.
Yeah, if you both had
But
insurance, you didn't
now
have to pay.
you will. And the reason is that if that secondary payer's benefit is equal to what that primary would pay, they'll say, no, we're not going to pay because their benefit was greater or is equal to ours. So now you're still going to be left with paying that copay.
That's what
they have really found a way to mess you up, haven't they?
Yes. So that has changed tremendously.
Wow.
So that's what I'm saying. They have changed the rules so much. I mean, remember, doctors didn't used to have to be credentialed. You just could sign up with that plan.
Right,
and
exactly.
Be with it. Every single doctor has to be credentialed. Every single one.
That's
so
awesome.
If you got 10 doctors in your practice.
Yeah, but like you said, they would just register the facility.
Mm-hmm.
And whatever doctors was operating
but
out
now
of that facility.
every doctor has to have their own TIN number, the tax ID number, to be in that. It's not like that anymore. I'm telling you. So you got to credential every single doctor.
Yeah.
Okay. So that's the other thing about the coordination of benefits, is, as far as that, it does not mean you're not going to have any out-of-pocket costs. And people get tripped up by that. Well, both my insurance is going to cover it. Not necessarily. And then if your insurance has a deductible, then that deductible is going to come out.
Right.
So you're still going to be stuck with paying that deductible, even if you got secondary coverage, because secondary coverage is not going to cover it if that fee is equal to or greater than what they would pay. You're stuck with that. You're going to pay.
The thing with the deductible is that if because you may have a deductible on one plan and not the other. So if it's on your, so that money has to be accounted for first. Mm-hmm. And then, so your secondary insurance may not even come into play. Because by the time you pay the deductible and your primary pays whatever to whatever benefit level it allows for that procedure, then, your secondary may not even pick up.
Right. And the other thing is that, first of all, let's clear the air on this. If your dental office is billing your insurance, that's a courtesy because they don't have to. So let's understand, first of all, they're not made to do that. It's a courtesy for us to do it.
Yeah.
Okay, for one. Number two, they don't have to bill your secondary. That's, again, another courtesy. So there's no responsibility for a dental office to bill your insurance. They can tell you, well, we won't wait for your insurance to pay. You need to pay us today and bill yourself. Because there's a lot of dentists here in Atlanta that don't take insurance. They don't want the hassle. They don't want to be bothered with it. They're not in network with anybody. You bill it, you do it yourself.
That's the same thing I was thinking, Deb. I was like, I wouldn't be going to them. And I understand that it's a courtesy, but I'd have to find a doctor who wanted to be courteous.
Right. I mean, true. I mean, I definitely agree. I definitely agree. But there are a lot of them out there that don't participate. And when you are going to a dentist and they don't participate with your network, you don't have anything that dental insurance can do to protect you, because that doctor is not in network and they can charge whatever they want, do whatever they want, bill you. They can balance bill you what is not paid. And there's nothing an insurance company can do because that doctor is not in their network. They cannot protect you.
But see, when you talk about practices that only operate a cash only dental practice, the only way I can see that type of office surviving is that they would only do straight up emergency services.
No, they're doing a lot of cosmetics.
Who would not use their insurance if they have it available to them?
Right. I mean, you just get your bill and your receipt, and you just can either pull the 80. Like they may print off the form for you and tell you that, okay, here it is. You can send it in yourself, or like you said, they're gonna take their money up front. Like I said, there's a few doctors here in this area that do a lot of cosmetic work, and they don't take insurance. They say, hey, pay us, and then you collect the money from your insurance.
No, they wouldn't be my
So
doctor.
I wouldn't either. I don't go to them, but I mean, it happens. And like I had wanted to go get some stuff done for a couple doctors that I knew did some excellent cosmetic work. But then when I found out that they did not take insurance, I said, well, I guess I won't be going there. I'll give you a perfect example. What is her name? She played on the she's on one of those Atlanta dental, one of the Atlanta medical. What's her name? She's on the Atlanta MD thing. She Doctor. What is her name? She's Married to Medicine. That one of those
Oh,
dentists.
Dr.
Oh, she's on Married to Medicine.
Yeah,
Dr. Heavenly.
yeah. Dr. Heavenly doesn't take insurance, and she's one of the top people in here that does.
She wouldn't be my doctor anyway.
Yeah, right. But she does.
I couldn't listen to her.
Honestly, her dental work is the bomb. She
I'm
is
sure she's a good
excellent.
doctor.
She is she's very good, and she does a lot of what we call roundhouse implants. So she does what they call the screw in. So say, for example, you want to get all this done, the full denture or whatever it is, they have like 1, 2, 3, 4, 6 implants that they put in there, and then they put that in there and they screw it in. So it never comes out, but it looks more natural. It's a much better denture. Beautiful. She's excellent at that. She's known for that, but she does not take insurance. You're going to come in there. Yeah.
But I mean, how many insurance companies pay for implants anyway?
Yeah.
Some do, very few, but some do. But it's not a lot because it's still considered such a cosmetic benefit because they figure if the tooth is missing, you're either going to do one or two things, either get a bridge or you get a partial. So you know if you got more than one tooth missing in that area, a bridge ain't flying. You're going to get a partial because they're going to say restore everything that's missing.
So after Kim mentioned something that we didn't talk about on the on when we were talking about dental cleanings. What are the general benefits now on the perio maintenance?
They're every 6 months.
Still every 6 months.
It's every 6 months, but again, you have got to show periodontal past history for it to be covered. So you can't just go in there and they say, oh, well, we'll do a perio cleaning and you've never had a scaling or root planning.
Right.
And then if your insurance has changed, usually you got to pull that history to send to that new payer, that new insurance company to prove that you've had that history.
Right.
Mm-hmm. Definitely. And like I said, I really wish the commercial insurances would get on board with covering a composite fillings on molars and premolars now because offices are not doing amalgams anymore.
That's amazing that Medicaid is paying for that.
Sure will. Medicaid will pay for it, but not your commercial insurance. They will downgrade it to an amalgam and you will pay the additional cost. And I mean, places that I know are known for that for sure. You know, almost all of them, MetLife, Cigna, they're all doing it. There's no particular plan to get that's going to eliminate that. And again, it's based on what type of plan that your employer selects.
Kim says most insurances do pay for composite on posterior teeth.
Only on posterior, but not on molars. They're not covering it on molars. And a lot of insurances are not paying it on posterior, Kim, because she's saying they do. I'm not sure, but I know here I've seen a lot for sure. I know MetLife.
And they're different too. From being
I know
in Michigan
MetLife,
and being in Georgia.
right? I know MetLife, Aetna. I know MetLife, Aetna. They don't cover it on posterior too, unless you are a special group. A molar is a molar is not a posterior. I mean, a molar is a posterior, but your bicuspids, those are your premolars, and they're not covering it on those. They're not covering it. They're downgrading it to an amalgam.
Kim, are they paying for? Are you seeing the insurance here in Michigan paying for cuspids, composites on cuspids? Anyway, yeah, that's a good thing about Medicaid. That's one good thing.
Mm-hmm. I mean, for a lot of it has,
Go ahead.
A lot of it has changed to where, you know, they're not covering as much on adults anymore because, you know, Medicaid is a state by state based plan. If that money comes out of state money, it doesn't come out of federal money like Medicare.
Right.
So depending, because, you know, they you remember back in the day, Medicaid used to do everything for adults. Not so much anymore. They're not covering
No,
that.
and that, as a matter of fact, I think all you can do is get cleanings and fillings.
Some of them are not even doing fillings. They only doing extractions and cleaning. Some of them are just doing that. You can't even get fillings. They're just covering extractions. And only simple
and force you
extractions.
into a prosthetic.
So what are you finding? Because eventually I'm retiring in 2 days. So
good.
yeah,
Good
and
for you.
I'm going to be.
Congratulations.
I will have Medicare.
Care.
Yeah, I'll have Medicare. So what are they covering, Tonya?
I mean, again, it depends on what type of plan you pick. Like one of the biggest plans with Medicare is Humana. Humana is offering a dental rider attached to the medical plan. If you have the opportunity to keep your dental or something like that through your employer, like if you can just pay it yourself, then keep it. See if they offer you to
I do
pay
have
it.
that option to keep it with my employer.
Yeah, and usually your dental
it's
not that expensive.
Okay.
So it depends on what they
Thank
offer.
you.
So if you can just keep it as Cobra, keep it for Cobra as long as you can.
Okay.
And then do it. But if you're having to pick,
so expensive.
Medical Cobra is expensive. Dental
But
Cobra it's usually not. It's usually
and I was even told that our medical Cobra is just about the same as the copay that I would have to pay for Medicare.
But this is the thing about Medicare. This is the thing about Medicare. When you get ready to go into Medicare and it's time for you to apply for your Medicare Part A and B, if you don't apply for it, you get penalized for it.
Right. I already have A. They when you sign up, they automatically give it to you. And since I was working, when B came along, they were getting ready to bill me for it. I'm like, no, I'm paying I have insurance with my company. So they took it off.
But that's because you still work. But now that you're going to be retiring, you need to double check to see what the guidelines are going to be for that, because that's changed also.
Okay.
They're kind of, so, and then like I said.
Well, I know they already told me I'm going to be penalized. Well, they said that, but then I was also told by somebody who's already done it before me is that they will make exceptions if you were working.
Yes, so you have to check
middle of that. But you have to do it like right away.
Yeah, it's within 60 days or something of your life event is what they call it. Okay. So you have to check and make sure you look into all of that. But I mean, a lot of them, like, a lot of your HMOs like HAP, Blue Care Network, those plans that offer a Medicare Advantage to it, you need to look into it and see what it is and check and see if that works for you.
Kim says, I wouldn't pay for Cobra Dental. I would definitely go with the Medicaid or Medicare that has a dental on it that covers preventive restorative.
I don't agree with that because I know Medicare is not covering that much. A lot of those plans and those treatments are being denied. I see it happen because the doctor's not
getting ready to say I don't know much about Medicare. As that if I don't
Medicaid, right? But Medicaid is not giving benefits for adults. Medicaid benefits.
Okay, I'm only interested in Medicare.
Yeah, she wouldn't be eligible for Medicaid. She's only eligible for Medicare. Right. So that wouldn't even work for her. But like I said, you have to check into that. And see, Kim works in a practice that does not, I don't think, has but one doctor. So it's easier for them. But when you start going into your Medicare, like I said, and you go into whoever it is, yeah, I will keep my Cobra. If it's not very expensive, because I kept my Cobra when I got laid off one time for like a year, almost 2 years. And it was only costing me like $15 a month, $20 a month.
Okay, see,
so
they won't let me know until I'm not working there, how much my Cobra is going to cost. So they said they'll be sending me, because I stay covered. Yeah, I stay covered until the end of this month. And then before this month is over, they'll send me the information on how much the Cobra is going to cost.
Yeah, and if you
now, here's my question: can you get Cobra Dental without Cobra Medical?
Yeah.
Yeah, you can, because there's
okay. I didn't know you could,
because you have, like, with me, I have Blue Cross Medical and Delta for dental. So, and I can even do a vision because I have a separate vision plan. So I can do Cobra for vision.
Yeah.
Okay, well then that's good. Because that can give you some options in terms of with your medical and stuff like that. I just know Cobra was just The last
Your
time
medical Cobra
like
is your medical Cobra is
$1,800
very expensive. Your medical Cobra is very expensive, but not
Yeah.
nearly as expensive as your dental. Your dental Cobra is usually not that bad.
Okay,
And
well,
then
I'll be doing
secondly,
research on all of that stuff in about a week.
I
She
mean,
said,
Kim is
I would,
right. If you
especially if
don't
you don't need
need
a lot of
a
See,
dental
and I
dental
work.
don't.
work,
I do need 43. I will be going for 43, 41s. That's the one thing that I want to
so
make
if you did
sure
it,
is going
but
to
like,
be
what about
covered.
your spouse's coverage? Are you able to be on his? Would you need
Well,
yours?
well, I can, yeah, but he missed the open enrollment, so we have to wait for
The
Okay.
next
the end of
year,
the
the next
year.
opening,
So
yeah.
I still want to have
Well,
coverage
yeah. So
for
then you probably
till the
just
end
need
of
to
the
keep your
year.
Cobra
Right.
to his next open enrollment, and then you can decide and sit down and check what benefits are going to work better for you.
Yeah.
But that's what I would suggest. I would try to keep my traditional plan Cobras as long as I could, as opposed to getting a rider on your health care if you're going to go with a Medicare plan, the
Okay,
Medicare Advantage plan.
because if you stop the Medicare and you go to other insurance when you come back, then they penalize you again, right?
Yeah, usually they do, and it's not cheap. So it's because
Yeah.
I think Medicare now is like 106 a month or something like that.
I think I was told it was 150 and then it just went up to
Wow,
160
is it that expensive now?
for yeah.
Wow.
Okay,
For
yeah.
No,
So
Medicare?
wait. No, I think it is 106.
that's what I thought. I thought it was
Yeah, I
106.
think it is 106, not 160.
Yeah,
106.
that's what I thought. It seemed like the last time when I got a thing on that, it said it was going to be 106 because it hasn't changed in the last 2 years.
Yeah.
But yeah, but like you said, when you miss that open enrollment, once you become a certain age with Medicare and you get to that age in that part, if you don't take it, they do penalize you for it. And then the next time you get ready to enroll in it, it's like $50, $60 more for you to have it.
Yeah,
So
but
you
they did
definitely
tell
want
me
to
that I
pay.
could probably file for an exception because I was working and then he's working. So
Yeah. Kim
that's why
keeps
she
saying
would not do
I
COVID.
don't agree with Kim for dental Cobra. Not at all. I will keep my dental Cobra because
You
this is
still
the thing.
fight?
Right. And
I'll
this is
follow
the
up with you
reason.
guys and let
Right.
you know which one
But I'm gonna
costs the
tell you
most.
why. Another reason why too is because you are going to be subjected
Tonya,
to
come on
waiting.
screen and say it to
Right.
your face, Tonya.
The thing is see when you get to those plans for those Medicare Advantage dental plans, they also have waiting periods. So now you're stuck with a waiting period. So
You
now
know,
you're
if Kim was
all
on
over
this
it.
screen, this would be a full live argument. You know that, don't you?
So I
Hmm.
have another question for you guys because talking about
Oh, Tonya
doing
and
the
Kim, they are still oil
Medicare.
and water.
So when I
Oh,
was
Lord.
looking up things about people who are aging and their oral health, and they were talking about low income people who they maybe work enough so that they make too much to afford, to be qualified for Medicaid. They're not old enough to qualify for Medicare. So they have a few different options for low income or aged people who are trying to get dental insurance. And I was just wondering if you're familiar with those kind of plans. Like there's the like Veterans Affairs Dental or Health Information Hub, United Way, Dental Life Network. Are you familiar with any of those
Yes.
things?
And the thing about those is they're cheap premiums and it's giving you a benefit. Again, you're looking at waiting periods. You have to look at the waiting periods and see when you are able to actually use the plan. Like I told you, they break it up into into a basic, and then there's major. The basic will usually be effective as soon as you enroll
That
in
is
the plan.
bananas to me.
Then you have to wait 6 months before you can do filling and restorative type stuff. Then you got to wait a year for the dentures, partials, root canals, surgical extractions, those type of things. However, that means if you're going to do that, they're expecting you to renew that policy for that second year. Then they will waive that 1 year waiting period. So now you can go and do these things. But if you don't keep
Okay.
it for that second year, you're going to lose all that time that you may have spent having that plan.
Okay. Because I'm
So
going to be
that's
doing life coaching for seniors, and this will be good to know
Yes,
to help
yeah.
people who are,
absolutely.
I lost my page. What did I do? Uh-oh. Can you still hear me?
Yes,
Yes,
we see you and we hear
we
you.
hear you
Oh,
and
you
see
see
you.
me in? Okay. Oh, there I go. I
Yeah.
couldn't see
So,
everybody.
right. The thing about it is, again, you have to look at what the benefits are in terms of the waiting period. So most of these plans, like I said, they're designed to not let a person come in and spend a few dollars on premiums and copays and get all this dental work done and then cancel the plan.
Mm-hmm.
So
Okay.
they're designing
Okay.
that to force you into staying with the plan to get the things that you need to get done.
Okay. So now what about dental schools and dental hygiene schools? What are your thoughts on them for care for
I
seniors
mean, they've
or low
been pretty
income
good in
people?
the past, but keep in mind they have long appointment times. You probably can't get
Yeah,
in there to get anything done because everybody know they're cheap.
it takes a long
So
time to get
yeah, it
appointments.
takes a long time. I mean, like UD, remember they had one of the cheapest orthodontic
$25.
programs, right? But then remember their orthodontic program was very, very cheap. So
Yeah.
people have to wait almost a year, if not longer, to get into U of B's orthodontic program.
Okay.
Yeah.
So and the same thing's
Now
going on
here
with
in
Hampton.
Michigan, WC3 now has a dental school.
Oh,
Well, they've
WC3?
always got a dental or
Right here
hygiene.
on the at the Northwest campus.
But is it just hygiene or is it actual dental?
It's a dental school. I don't know what they offer or
It's
whatever.
always been only hygiene. They've only got hygienists.
No, here's what I'm saying though. I don't know if I don't think that it's only hygiene. I think that they do some restorative treatment.
Hmm.
But now if they do prosthetics and all of that, I don't know.
Right, because I've
But
never known, they're not a 4-year credit program. So how can you be a dentist
no,
with a
Well, they
but
do have some 4-year some 4 year areas of study, but they probably don't have dental. And
not
she's
for
in,
saying,
dentists?
in
yeah, and
hygiene
There's
is not
assisting
no
for
hygiene, not for
dentists.
any
dentists.
dental
Yeah.
program. You got to do 4 years and then go to the dental school. They're only doing, like she said, what Kim is saying. WC3 has always been there for their hygiene programs forever. Those I know
Okay.
exist. So you can get your teeth cleaned for only a few dollars. And I
Okay, so
think
you could probably go to WC3.
yes, but again,
Okay.
they have long waiting,
They do
long
have
appointment
long
history
appointment
Okay.
because
schedule.
yeah,
Now
that's the only
that
thing
I do
about it.
know.
And then like if there's emergency treatment that needs to be done, receiving hospital does emergency dental extraction, so you can look into checking receiving hospital and see if they still do it. And then
Okay.
I
Yeah,
those
was
are
I
they
was
do.
just
That's where
ready to say.
my
they
dentist
do a
only works 1 day a week at her office. The rest of the time she works at receiving.
okay, and see they have what they call a sliding scale. So they'll go by your income and stuff like that as far as what you're gonna pay. So check with receiving and see if that's how they're doing and what they're doing there. I know they were known for that. That's the only
Okay.
hospital that I can think of that does that. Harper was doing it, but I don't think they do it anymore. But you have to check into that. And another thing people don't realize too, you know how you used to go to the oral surgery and you just get your teeth extracted, your molars and whatever. Well, a lot
Mhm.
of the dental plans aren't covering that. They're making you bill your medical insurance first before they'll cover it.
Because they're considering now
Because
that
it's
was
surgical.
now that is something that is not all that new.
Yeah, that's not
There
very
were
new.
certain insurance plans. There were
Hmm.
certain insurance plans when you got off into surgical extractions, they would make you bill it to the health insurance rather
Right.
than the dental
They'll
plan.
do the
But now that has been
D7210.
around for a long time.
Right, the D7210, D7250, they'll do those usually with your dental plan. But the 7230 partial bony and the full bony, usually you got to do your medical first. Only,
Yeah,
and then only unless you say, hey, I don't have medical, then you go ahead on and bill your dental. But those are things
right.
I just want people to be aware of and things like
Yeah,
that too.
that's a good one.
Hmm.
But yeah, that's been around
Yep.
for a long time.
Yep. And then also, like a lot of your federal plans now, they have a dental rider attached to their medical plan, and that has to be billed before they will bill their actual dental plan. And a lot of them not realizing that they think that rider, either one, they don't know they have the rider, or two, they think the rider is an actual real dental plan, but it's not. It's just a rider, and it's only covering certain things like a simple exam, cleaning, x-rays. And Blue Cross and United Healthcare, I'm sorry, Blue Cross for sure, federal plans are definitely part of that. but some of United Concordia and Humana have federal plans, and then their medical plans have that rider attached to it. So that's why I'm saying to people, learn your benefits, know what you have. Because again, it's not a dental office responsibility to know your benefits. It's up to you. Those are your benefits. You need to know what they are. If you're not sure, find out what type of treatment and what things you need to get done. Get that dental list from your provider, the treatment plan, and you can call your insurance company, give them the codes, tell them what work is looking to be done, what will be covered. Other things is, be safe. Anything over $300, have a pre-authorization sent in to know what's going to be covered. And be careful that when you go into these DSO organizations and they're just plopping you down and you sending a different doctor every single time you go in there, if they say, look, only Dr. Red and Dr. Blue are credentialed, then you tell them, hey, you can only put my appointments with Dr. Red. Otherwise, my plan is not going to cover it.
And see, most patients won't even know that they need to have a credentialed doctor.
Right. That's why I'm saying this now.
They need to check with their insurance company, or when they go into the dentist's office, even ask, is this a doctor that my insurance will cover?
And they may not know. They may have
right. They may not know, especially in a DSO situation. They don't know if those doctors are not all credentialed. So your best bet is to call your insurance company and say, hey, they told me they're going to put me with Dr. Orange today. Is Dr. Orange credentialed with my plan? Oh, not Dr. Orange, but we got Dr. Purple and Dr. Green that's in that office, and you can be seen by that doctor. Okay, thank you. And you go back and say, well, my plan only covers for me to be seen by Dr. Green and Dr. Orange.
Okay, and that'll be helpful for my seniors too.
Yeah, then that's who you set your appointments up with. And if they say, well, he's only here every, on this day, well, I guess I won't be back until that day, or whatever. Cover yourself. Don't make them force you into thinking, oh, if I gotta wait and see this doctor, and this doctor's booked up. Okay, well then I might have to just go find me a new dental office. That's what you do. You let yourself dictate what you need. This is your benefit. Right. Don't let them force you into anything.
Here's something that I want to make sure that the audience knows as well. When we talk about signing, when they want to do major treatment on you, and they give you a treatment plan, even if you sign it, you are not obligated to that treatment until they actually go in your mouth and do procedures.
Exactly. Because remember, it's just an estimate of services. It's just an estimate of services that need to be performed. It is nothing that you have signed up and got to do. And do a little at a time if it's gonna cost you more out of pocket. Don't let them go and do all this work. And like I said, you turn around and you got all this money that you owe the office, or you don't, you go out here and you're signing up for care credit, and you can't get that bill paid in 6 months because it's $10,000.
Now, I know back in the day, we used to have customers who would come in October because they knew that their benefits were going to renew in January.
Yeah.
So they would get, the doctor would do a big treatment plan. I mean, the doctor would even encourage them, wait until this time to come in. Are they still doing that? Then doctors used to be so good about that.
You have to realize.
Hold on, y'all. This is the tip that we need to give them in terms of knowing the month that your benefits renew. That's important. Let's give them that information.
Mm-hmm. That's what I said. Know your plan. If it's calendar year, that means it's going to start in January. That means your benefits renew every January. If it's not, then it's based off of Kim. What's the other term? It's not calendar year; it's benefit year. Then that
fiscal year. October 1.
Or it could be April 1, or it could be May 1st. It could be anything outside of January 1st. So you need to know when that is. So that's what I'm saying. Know your benefits. If you don't want to read, because that's the thing, people don't like to read. You don't want to read, it's too much. And then again, it's like a foreign language.
Sometimes it's not reading, it's comprehension.
Yeah.
If I'm reading something and it's above my head, I don't understand it. It could be in French. It wouldn't make any
difference. Go and make a phone call and talk to the people that are there. And the thing is this, if they misinform you on some information, then that's a totally different thing, because now that call's being recorded at your insurance company. They can pull it and say, well, I talked to Kim, and Kim told me that my crowns will be covered on teeth number A, B, and C if I was to get porcelain crowns, and I gave her the code. Totally different, because now it's like, okay, well, we misinformed the patient. But even with that being said, that doesn't always win the situation, because still the policy and what's in it is still going to trump it. So all I'm saying, the best thing to do is to get it in writing, get a pre-authorization, and get it sent in so it'll come back and say what's going to be covered and what is not.
And then also to know your benefit year so that you can schedule. If it's going to cost more than what your plan is for this 1 year, you can add them together and finish it, start it at the
Stretch it
end
out
of the year and then finish it up at the beginning of the next time, so that you can have everything covered and you can get it all done within a few months, and then that's it.
Absolutely. Some things you're gonna need to pace it out.
Let me integrate here for 1 second, because I want to make sure that we are not giving people the wrong, not the wrong thing, but in terms of we want to make sure that we are speaking to everybody at all levels, at all competencies, and all of that kind of stuff. If you have, because there are some people who do not read well. There are people who may be able to read, but if I don't really understand how it works, it's like being in another language or whatever. If you don't understand what your policy is saying and how to break that information down and make it make sense to what you need to do, in terms of, if you are aware, the first thing you need to do is to actually sit in a doctor's chair and let them tell you what their treatment is that they're recommending for you. That's the start.
So have that consultation and sit down and get that. Yes, have that consultation.
Yeah. So, but when you call, because the thing of it is that you can say, it's your responsibility. You got to know, it's up to you to call your insurance company. But if I don't know what I'm supposed to be asking, if I don't know what it's not going to make a hill of beans of difference, because I'm still lost, because they're going to give you general information. Those customer service people at the insurance company, I used to be one. We got 100 calls in the queue. I'm going to tell you just what you asked me, and thank you and goodbye.
Yes. So those type of things are really good for minor, well, I'm going to say minor, but for more so singular type things. If they give you a big, long treatment plan, calling on the phone is not the best option. Again, that's why I encourage and strongly urge, get the pre-authorization done in writing. And get it in writing, because this way, once it's being reviewed at the insurance company, they're looking at, have you maxed out? So if you put in there 4 crowns, now it's telling you in your pre-authorization, you've maxed out a benefit. We're only going to cover 3 of the crowns. That 4th crown, you're going to be responsible for 100% cost if you've maxed out a benefit. So then that goes, and you say, you know what? Let me just do these 2 that I need to do the first, and I'll do the other stuff next time.
That's a big one, Tonya. That's a big one. A lot of times they write up treatment plans, and like you said, it may be $10,000 worth of treatment, and you only get $2,000 a year. So just start there.
Yeah.
I don't even have enough money for the whole year.
It don't make sense. I mean, I see it all the time. Kim said pre-D, anything over $300. Absolutely. Anything over $300. I mean, I've seen it. You get ready to get dentures. Oh yeah, I'm gonna get dentures. Give me dentures. So now you got to get all these extractions done, right? So now you got 20, 30, we got 32 teeth in your mouth, and you got them all. You got them all. But maybe you only got 15 left. Whatever. But they're saying, hey, these are surgical extractions. These 7210. Surgical extraction is usually about $175 per tooth and up. Okay.
What?
Yes. So how soon is it going to take you to max out $1,000? You're done. You're getting ready to come out of pocket. Okay,
So
now
you're gonna be
what if
walking
your
around with no
insurance
teeth, huh?
client?
Kim is cracking up.
But what if your plan is only enough benefits to pay for your extraction? So now you got to wait a whole nother year before you can start your denture. So
Especially if you
now
started it in January, right?
Kim said they charge $345 for a surgical extraction D7210.
Kim,
$345,
for
Kim.
what?
Good Lord. Okay, and you know it's all based off of reasonable and customary fees off of zip codes too, so that make a difference. But what I'm saying is, you may only be able to start part of it. She said, yes, you may not be able to start only part of that dental, and now you got to spend the whole next year with no teeth because your insurance is not getting ready to cover your denture because you've maxed out. So you got to pace this stuff out. You got to pace it out. So that's what I'm saying. The pre-authorization is going to help you to know where you stand. So if it's saying, okay, you need 15 extractions, but only 5 of them are going to be covered, then figure out what 5 teeth that you need to have extracted. Maybe the ones that are causing the most problems. If there's abscessing or just in pain all the time, they're sensitive. Make a decision there and see what you can do. Okay. And determine from breaking that down how much you need to look in terms of time and all of these different things. It all makes a difference. And what I'm saying to people is, don't let them, and really is bullying you into doing stuff that you can't afford or it's not going to be covered. Don't get bullied.
Necessary.
Yeah, don't get bullied into it. Don't get bullied into it.
So how will a patient know if what the treatment plan was is not necessary?
Second opinion.
No, not necessarily, because again, now you're going to run into the fact that is your insurance going to cover that exam to go to another doctor? Now you out of more money because now that you're going to a new dentist, you're going to get that exam maybe denied. That's $150. Get a pre-authorization. Send it to my insurance company and let them tell me if they're going to cover it and how much they're going to cover it. That's the safest thing you can do.
So when they do those pre-authorizations, let's say there's this big long treatment plan, are they going to pre-authorize the thing that's most necessary?
They can send the pre-authorization in for everything. They can send it in for everything.
Your insurance company, are they going to, like, they send in the whole treatment plan, and so your insurance company is now processing it. Do they approve what's most necessary?
No, we don't pull it based off of that. We're going to approve up to your maximum amount. So if the first thing you do, okay, let's say this, and give you a good example. You want denture, but you need 10 extractions. Okay. Now you put in 10 extractions, upper partial, lower partial, upper denture, lower, whichever. Whatever is there, once we look at how much it is, we're only going to apply whatever your benefit is. That's up to you to determine how you're going to apply it. But we're telling you, you get $1,000.
Well, you know what though? I think that depends on the processor because
not now.
Well, listen to what I'm saying. Listen to what I'm saying. Even now, because I'm talking about human compassion now. I'm saying if you get a processor that looks at a treatment plan and they just got all of these random procedures on there, they're going to look at it and say, okay, they're going to have, so I only have X amount of dollars to approve it. So I'm going to look at the extractions first because I know this has to be done before we even get to the prosthetics or whatever.
Maybe.
And I said it depends on if you get
because understand this.
But other than that, they need to know that it's just random.
Right, but understand this. They're on production. They're not getting ready to fall in love with your claim and pick out what's going to work and what ain't going to done. I got to get my production met. They don't give a hoot about that. Also, simple things and certain things they're not even being seen by a processor. They're being done automatically. My company, our people that are doing claims processing and physically touching a claim is if it's something that needs to really be reviewed by a dental consultant. Most stuff is being paid automatically through the system. So once the dental office does their electronic billing and they bill it, it's going through our system and it's saying, okay, history, exam, x-rays, cleaning, filling. Nothing's been done on that. Boom, we're paying it.
So everything is more automated now.
Yes. You don't have
That's
a
really
whole lot of
different from the
claims.
days when we used to take the X-ray into the
Yes.
into the doctor's office
And
and
you
he
looking
read
at
all
it,
the
doing all
X-ray
that,
and
going, hold up.
yes.
No, that's not it
They're
anymore.
not
And
doing
like
that
I
anymore.
said, they're on
Wow.
production. Many of these
That's
insurance
unfortunate.
companies, you got to process almost 60, 70 claims an hour. So you ain't got time to be saying, oh, they need to get them extractions done first. They need to do, you just going by, okay, I'm applying this, I'm applying that, I'm applying this, boom, that's it. That's how that's going to work. So yes, it's I'm telling you, it's different. It ain't the same no more. It's different.
So I'm gonna have to check out at 9 o'clock.
Oh yeah, we are.
Yeah, it's almost a minute.
Okay, I
But
wasn't sure.
so let's go ahead and just, kind of casually wrap this up. And just all I want to say is, first of all, learn and know your benefits. Anything that you need to have done as far as dental treatment that's going to exceed $300, get it pre-authorized, predetermined. That's what you do. Tell them, hey, can you send this to my insurance company and let's see what they're going to cover and how much I'm going to be responsible for. Know that. If you're going to going to a dentist, also know what type of plan you have. Do you have a PPO plan? Do you have a Premier plan? Because all those play different keys into what's going to be covered. A PPO plan is a cheaper plan. It's cheaper out-of-pocket cost for the consumer. A Premier plan, usually you're going to pay more out-of-pocket. So know and get your information. And I know people are not going to understand everything that I've said today. I get that. But again, get it in writing from the insurance company so you can know. Talk to the people at the insurance company. Hey, look, I don't know what they're talking about. They said I need this, this, and this. What's cover? How do I do this? Is that doctor on my plan? Can I go to the? Ask the question. Get the information and have it. Again, I want people to not get bullied into doing costly dental work and sometimes even having to do dental work that may not even be necessary.
Absolutely. Listen, guys, we got to log off. And I know that you got some good information tonight. And listen, it's all love. We've been friends for 30 years. Every last one of us.
Yeah.
We argue, but we're going to give you what you need.
Yep, and we all met because we were working for a dental insurance company some years ago, and that's it. And we ran that bad boy. We took it over.
Yes. So listen, go back and look at the replay. Hit the like button. Subscribe to the channel so you can get more information like this stuff you can use. The news you can use.
Absolutely.
And we'll be back to see you. You'll see all of us. There's a group of us girls. And we get together every year and come on the platform and meet up and all of that kind of stuff. So you'll get to know these characters. They're like Bible characters.
Yeah.
And good night, everybody.
Good night, everybody.
Bye.
Good night, everybody. Remember to take care of your kids in the dentist office.
That's right. Brush your teeth every day, twice a day, in the morning and at night. And floss.
We didn't get to the flossing, but we'll have to do a part 2. We'll see you guys next time.
Good night.
Enjoy more of our videos on the Community Advocate Network channel. And don't forget to like, share, and subscribe. If you would like to advertise your service, special announcement, or event, you may contact us at the Community Advocate Network at gmail.com. For community resources or services, visit our website at www.cammichigan.com.